Today, we're diving into three important dental surgical procedures: root resection, hemisection, and root separation. These techniques are essential for managing complex dental cases, especially when conventional treatments are not enough. Understanding their differences and applications can help both dental professionals and patients make informed decisions. In this video, we'll break down what each procedure involves, when they're indicated, and what steps are taken during surgery. Let's start by defining each technique before moving into the procedural details and clinical considerations. Root resection is a surgical procedure where all or a portion of a tooth's root is removed. This can be done either before or after endodontic treatment, depending on the clinical situation. The main goal is to eliminate the diseased or damaged root while preserving the rest of the tooth structure. Root resection is particularly useful when one root is severely compromised, but the remaining roots are healthy and can support the tooth. This approach helps retain the tooth in the mouth, avoiding extraction and maintaining function. Hemisection refers to the surgical removal of a root along with the associated part of the crown. This procedure is most commonly performed on lower molars, where the tooth is divided into two separate parts. By removing the affected root and its crown portion, the dentist can address localized disease while preserving the rest of the tooth. Hemisection is a valuable option when only one root is involved and the remaining structure is healthy enough to function independently. Root separation, also known as bicuspidization, involves sectioning the root complex while maintaining all roots. Unlike root resection or hemisection, no roots are removed. Instead, the roots are separated to allow for individual management and improved oral hygiene. This technique is particularly useful in cases where the roots are structurally sound but need to be separated due to periodontal or anatomical concerns. The goal is to preserve as much natural tooth structure as possible. The procedure begins with the administration of appropriate local anesthesia to ensure patient comfort. Once numb, a full-thickness mucoperiosteal flap is carefully released to expose the underlying bone and tooth structure. This step is crucial for gaining access to the surgical site and allows for precise manipulation during the following stages. Proper flap design and handling help minimize trauma and promote optimal healing after the procedure. After the surgical site is exposed, thorough debridement is performed to remove any infected or granulation tissue. The root, with advanced bone loss, is then identified for resection. An oblique cut is made from the apical area toward the contact point, passing through the tooth to the facial and distal orifices. This precise incision ensures that only the compromised root is targeted, preserving the healthy portions of the tooth. In cases where the root is still vital, the type of incision is especially important. A horizontal incision through the root is recommended, as an oblique cut can expose a larger surface area of the pulp chamber or radicular pulp. This exposure increases the risk of postoperative pain and complications. By using a horizontal incision, the dentist minimizes trauma to the pulp and helps ensure a smoother recovery for the patient. Once the sectioning is complete, the compromised root is gently elevated from its socket and removed. If necessary, odontoplasty is performed to smooth out any furcation deformities, ensuring a clean and healthy area for healing. In cases where bony defects are present in adjacent teeth, additional resective or regenerative procedures may be carried out to restore bone and support the remaining tooth structure. After all surgical steps are completed, the mucoperiosteal flaps are carefully approximated and sutured back into position. This step is essential for protecting the surgical site, promoting healing, and maintaining the proper position of the remaining tooth and tissues. Proper suturing technique helps reduce the risk of infection and ensures a stable environment for recovery. Root resection, hemisection, and root separation are indicated in cases of severe bone loss affecting one or more roots, especially when regenerative procedures are not feasible. They are also used in cases of advanced furcation involvement or severe root recession. However, these procedures are contraindicated in patients with systemic diseases, poor oral hygiene, fused roots, unfavorable tissue architecture, or roots that cannot be treated endodontically. Careful patient selection is critical for successful outcomes. In summary, root resection, hemisection, and root separation are valuable surgical options for preserving teeth that might otherwise be lost. By understanding the indications, procedural steps, and limitations of each technique, dental professionals can provide targeted care that maximizes tooth retention and patient comfort. These procedures require careful planning and execution, but offer significant benefits in complex dental cases.